All right, I'll call the meeting of the Caldwell County Board of Health to order this evening for Thursday, February the 2nd, 2023. We'd like to welcome those who are in attendance in our audience this evening, as well as those who are joining us by TV. And I don't think we have anybody signed up for public comment this evening. So we'll go into our invocation time, and Dr. McBurney is going to lead us in that. And then we'll follow that with our Pledge of Allegiance, and Sandra James will lead us in that. So.
Okay, let's stand. Father God, we just come before you. We're just in awe of your presence, and we just thank you for each and every day that you give us, for the protection that you give us here. Lord, we thank you for the opportunity that we have to serve the community and the opportunity that we have to serve you. We thank you for each and every member of the staff, all of the healthcare providers, and all of the administrative folks who work diligently every day. Lord, just be with us. Help us to make reasonable decisions that are in keeping with your will and also in keeping with the protection of our community. And we just ask all this in Christ's name. Amen.
Amen.
Okay. Salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. That brings us to our announcements, and our Health Director, Miss Anna Martin.
I just have two announcements for us. The first one is just a reminder for board member trainings, and I believe Ms. Clark mentioned it earlier before we got started. The trainings will be online. Libby will send those in the minutes once again. If you don't mind, just to take those by August so we can make sure everybody's taking the trainings with the certificates and put them all online. The other announcement I had was our annual Child Health Safety Fair is April the 6th from 3 to 6 p.m. in front of the health department in the parking lot. It's going to be an in-person event this year, so we're not doing a drive-through, so we're really hoping to see more people come through.
All right. With that, I'll entertain a motion that we approve tonight's agenda. Do we have any amendments? Hearing no amendments, do I hear a motion we approve our agenda for this evening?
So moved.
Second.
And a second. All right, all in favor say aye.
Aye.
Aye. Any opposed? And that carries unanimously. And our first item is the approval of our corrected minutes from the October 6, 2022 meeting. I think we had left something out that needed to be amended there, so Libby has taken care of that. And I'll just move right on. Also, if we could get the approval for our minutes from our December the 1st, 2022 meeting. So do I hear a motion that we approve both sets of those minutes?
So moved.
Second.
And a second. Any other discussion or comment? All in favor say aye. Aye. Any opposed? And that motion carries as well. And that brings us to our approval of financial reports this evening. And Anna's going to take care of that for us.
Okay. So each of you should have a budget summary. It's the month ending in December. So with the budget, it's elapsed of 20%. 37% has been expended. We've run 34% total revenue and 42% of county revenue. So we're in good standing at this point.
All right. Does that go through December, right? So, yeah, about half a year. So we're right on target.
Yep.
Okay.
We are there.
All right. So any other comments or questions about our update there? Did we have any revisions?
I've got 3.
Okay.
Yes. So what I'll do is, if it's okay with you, I'll read them all, and then if you want to approve that way or disapprove, whatever we need to do. So the first one is a family planning revision. We received an agreement addenda from the state in the total amount of $1,507 to increase the budget in our family planning program within the clinic. This is going to be used for medical supplies. The next revision I have is for BSEP. So the health department did receive an agreement addendum revision for $13,000 from the state, basically to do a one-time funding opportunity to do BSEP programs and increase our services that way. And then the last one we just received yesterday. This is for TB control. We received a agreement addenda for the amount of $2,070 from the state. And as mentioned on this revision, North Carolina received Ukraine supplemental funds to enhance screening and treatment for active TB and latent TB infection. So we'll use those for medical supplies as well.
All right, so hearing those revisions, anybody have any questions or comments about any of those? All right, anybody, I'll entertain a motion that we adopt all three of these budget revisions as has been presented.
So moved.
Second.
And a second. Any other comment? Hearing none, all in favor say aye. Aye. Any opposed? And that motion carries as well. So thank you.
No problem.
We always like being able to expend money that's coming in from the state. So that's what keeps us moving. Next is our approval of Tiger Connect. Miss Jill Gregg's here with us this evening, and she's going to enlighten us.
We are seeking approval to purchase Tiger Connect. It is a HIPAA-compliant, secure text messaging program. It's two-way communication. Patient can text their provider, their nurses, and nurses or health department staff will be able to text them. We've run into an issue with a lot of different programs with CD and case management where patients are out of minutes or just prefer texting and don't want to answer us when we call. And we'll then in turn around and try to text our landline phone, which doesn't work. So this is HIPAA compliant. It would provide safety for the staff with sharing sensitive information. Also has a benefit to patients who are not a member of the health or not a part of the health department. They can actually text us and go to a virtual waiting room where we could do like initial appointment request, that sort of thing. It's real easy on the patient side. They'll get a text message. It'll say from Caldwell County Health Department, health provider, Jill Gregg, or whatever provider. It'll have a link. They will consent to reading text messages, and they'll see our message. They don't have to download an app. They don't have to create an account and password. And after they accept that initial agreement, their part is done. It also has the capability of doing pictures. So, is this rash normal? They can send us a picture. We can do, I call it FaceTime, but like video conferencing. So we can count that as visits for case management. And it also does push notifications. So if we have to close our office early for inclement weather, we can push that out to all those users as well. Do you have any questions before we get to the money?
Well, that was going to be my question.
So broken down, it is $40 per user per month. So we're asking for 12 users, and it's all the clinic nurses, our CD department, and CMARC nurses, plus Karen Clark, one of our providers who is very tech savvy. Dr. Picton wants his nurse to handle his calls. But and then plus a one-time $500 fee for startup costs, which includes all of our training. Since we do have some money in some of our state contract addendums, Anna asked if I would do a 5-year quote. And so for 5 years, the grand total is $29,300, and that's for 5 years.
So this will be taken out of our state grants that come through. The total amount would be for
So it'll be covered by grant
Yes.
funding?
Yep.
Well, that's all you needed to say, right?
So
Exactly.
the EHR that you have now, it doesn't provide that.
It doesn't. It provides, it will text the patient their appointment.
Okay.
But a good thing about, another thing I didn't mention, is that whole conversation that we have through Tiger Connect is able to be downloaded and uploaded into their medical record, so we don't have to go in and summarize the conversation. We can just put that text conversation into their medical record.
Oh, that's good.
So that'll save us some, some trouble. So,
So, just for me, you would issue, I assume, a patient a phone or a means of getting that text?
so they would,
Or you would use their
yeah,
number?
they could use their cell phone.
Okay.
And whenever they come in for an appointment, they can sign their consent then, or if they want to text us first before coming in, Tiger Connect sends them that consent.
But
And,
that would allow 12 people to have that capability, so I could only assume that's going to rotate, though. I mean, it may be 12.
yeah, so
for a
it's
period
12
of time, but-
licenses, so if, if a nurse left, we could transfer that license to the
So
next
it's
one.
not, these 12 users are not the end user, it's the person on the front end sending it?
Yes, the
Right, yeah.
nurses.
Yeah, we
You
can
could
have,
100 people.
yeah,
getting
1,000
that.
patients. but
Okay,
yeah.
all right.
Sorry.
I'm just trying to clarify.
Yeah.
Makes more sense.
Yeah.
Yeah.
The 12
Yeah.
users are health
understood what
department
she-
employees.
Okay,
But I've
all
worked with
right.
it before.
Sorry,
Oh,
it
it's
takes me
okay.
a minute to catch up.
It's okay. I've presented this a lot, told them they need to give me a job. I'll work for 'em. It sounds really good. We're the first health department in North Carolina that would be using Tiger Connect. They work with lots of health departments in other states, but the most, I guess the closest health system that they work with in North Carolina is Appalachian Regional Health System.
Yeah.
They use it.
Is
Okay.
the,
I wish all my doctors would use
is
it.
this 5-year
I hate those
cost payable up front, or is it divided up over the 5 years?
It's upfront. That way we could use that grant funding while we've got it, in case we don't have it in 5 years. They will do as little as, I think, 1 year, a 1-year contract, but since we had the money, we thought we'd just go for it.
Yeah,
Yeah.
makes sense. All right, any other questions? So do I hear a motion that we approve this contract for 5 years in the amount of $29,300 for Tiger Connect?
I'll make that motion.
I'll second it.
All right. A motion and a second. All in favor say aye. Aye. Any opposed? And that carries. So thank you again for being on the cutting edge, first in the state.
Yeah. I do want to give kudos to the clinical and community services department along with lab and CD department. This is not going to be the first program you're going to be hearing, the first health department in the state. They're bringing a lot to the health department, kind of getting it up to speed and things. There's a few more programs they're bringing in that they're going to bring to you that it's been fantastic to hear.
Yeah.
So I thank you for doing that.
Yes. All right. Next is a presentation on the Restart program. Jason Powell's with us this evening. Welcome.
Welcome. Thank you so much, very much. Great to see everybody. As Mr. Church said, I was approached by Anna to come and speak to you folks regarding the Restart program that was started back in 2021 in regards to a grant that we got and our expansion of that program from a small grant into this multidisciplinary team that we're looking to we're forming right now, and we're going to move forward to help combat the substance use disorder that we have here in this county and the entire country, so to say. So I put together a little bit of a presentation here that Paige will run through just to kind of give folks an idea of where we started, what we've been doing, some of our successes, and then what we're looking to do moving forward with our opioid settlement money and here within the county. So again, Caldwell County Restart began, and the Restart actually is an acronym: recognize, educate, stabilize, transform, accelerate, Rehabilitate and Trust. We began this, and this grant was offered to us during the pandemic. And if you go to the next slide, please. So the actual grant that was placed was opioids and COVID, supporting justice-involved individuals with substance use disorders during COVID-19. December 2020 is when we submitted that application. We all kind of knew what happened in 2020, COVID for sure. We were able to accept the grant in July of 2020, and then in September, same year, we were able to go live with Restart. Because we started a little bit late, the grant funding has been extended, so it has been extended until June of 2023 is when this particular grant will cease to fund us. Here's our mission statement. Again, kind of to the point, boilerplate for us, to be the advocate for individuals and their families affected by substance use disorders and misuse, because it's not just disorders, there is that misuse aspect of it as well. We're going to meet individuals where they are through the promotion of evidence-based strategies originating in prevention, harm reduction, treatment, and recovery, while ultimately reducing overdose deaths here within Caldwell County. A couple of stats to kind of back our what we looked at and then through COVID-19. Again, for North Carolina in 2020, per 100,000 people, there was 28 deaths related specifically to opioids. Does that results in 2,975 across North Carolinians across the entire state. For Caldwell County, that same calendar year, you can see we're a little bit above that. We're at 34 per 100,000 people. So that will be attributed to 28 deaths here in Caldwell County in 2020. 2021, again, COVID kind of raised its furious head, and through 2021, it all went up. The state of North Carolina, that rate increased to 39 out of 100,000, which equaled to that 4,041 North Carolinian deaths. Here in Caldwell County, it went rampant, 57.2 per 100,000 people. So that equates to 47 deaths for 2021 if our county had that 100,000 population, which we know we didn't at that year. So 2021, those numbers aren't quite in yet because a lot of those stats are actually situated on emergency department visits and overdose deaths that they see there. So those numbers are reported. They're not quite reported for 2020 on our opioid dashboards. But I can speak specifically for our program and what we were able to see during 2022, because we had one full calendar year of being able to obtain stats and to reach out and touch these folks. Again, being based within emergency services, we get to get out and see these calls. We're the boots on the ground. There's no one that sees it more than us as paramedics, as folks that are responding out to these calls. For 2021, that we were able to plot and date and track, we had 278 overdose EMS calls for service. And that's not overdose for a labetalol, a beta blocker that Meemaw forgot or she took too much of that. This is truly illicit drug overdoses in our county that we responded to with EMS. So 278 there. From those, we were able to identify 39 individuals that we were able to actually refer to inpatient residential treatments. So that's a fairly good number there, 39 folks that we were able to get to the treatment. Naloxone distribution, we're all aware of that wonderful drug and what it's able to do for the harm reduction strategies. For Restart, through 2022, we were able to distribute 453 doses of 4 milligram doses throughout the county. That's quite a bit. That's quite a bit that's out there that was able to save lives. This is going to be tough for folks to see, but we actually were tracking and mapping all of the overdoses that we respond to, all 278. You can see that yellow number there on the bottom left-hand corner. That's the 278. That's all Caldwell County. It's kind of difficult to see again, but on the far right-hand side, it's got a ledger there that's actually, it shows fatal overdoses that no naloxone was available. It's got fatal single dose naloxone. It has not fatal multiple dose naloxones, and then times where there's the non-fatal Those are the ones we like to see, the non-fatal with single-dose naloxone administration. And to kind of give you an idea of where the naloxone was given would be your light blue and your purple. And those are the non-fatals. Those are the ones that we want to see. Those are the ones where we're making that impact, where we were able to get there. Either it was done by EMS or it was done by field reversals prior to EMS arrival, if that's our law enforcement partners or if that's citizens out in the county that we've been able to disperse that. So that's kind of wide, and we kind of zoom in a little bit more. You guys can kind of see we've got Taylorsville Road running there, and there's 321 that's coming down, and then running out 18 out into Burke County there. We start to congregate, and you can kind of see where we are here in Lenore and where they're at. And one further map as we come in here, Paige, and it's right there. We can kind of see that right in that centralized area, you know, where the people are, that's usually where it is. That's usually where we start to see those overdoses. So through the grant that we were able to get back in 2020, that grant was able to supply 2 FTEs. And through those 2 FTEs with the program coordinator, which served as the administrative role for the grant. And then we had a peer support specialist. I'm sure everyone's heard of peer support and how that has become like the gold standard of being at the same table with physicians, with practitioners, with nurses, with paramedics, having that lived experience. So that's what we started out with back at the beginning of the grant. And moving forward, we have this multidisciplinary team staffing approach where not just having the program coordinator and a peer support specialist, we've expanded tremendously. We just hired a second peer support specialist. We've actually have a community paramedic, which is completely embedded within our program. So she will be out in the field being able to respond to these opioid, these overdoses for our PORT, which is our post-opioid response team. We're going to, with our collaboration with the health department, we've been able to embed also a social worker that will work with us. So as we start to kind of navigate through the system and find out instances and areas where folks need that assistance for that social worker, we have a point of contact liaison all ready to go. And then DSS, we're going to have another social worker from that aspect as well to be able to help round out our multidisciplinary team. So how are we going to do this? So these are the 4 big, the gold standards: the prevention, that harm reduction, the treatment, and then the recovery. That is basically the outline for all of what we need to do for these substance use disorders, especially as we move forward into the opioid settlement money. These are the ones that are going to formulate that outline. So currently, here's what we're here within Restart, our prevention side. Again, we're social media, we're active there. We've out with our media campaigns and radio interviews. Paige has done a spotlight on us, and Gina, actually our peer support specialist who came on board with the grant. We're helping train other healthcare providers out in hopefully to get into the schools. Our law enforcement partners, we train them when we are able to give them Narcan so that we can kind of keep from at times giving too much and allowing us to respond and to be there. Again, for the law enforcement on that side, we want that to be there for them first, and then again, just like for us, we want it to be there for us to treat us first, and then our patients. We've had expectant mother education. Tara Swanson, she's the other community paramedic on our EMS side. She's done a great job as far as assisting us with that, and as we move forward with our multidisciplinary team, we'll highlight that a lot more. Life skills training, bringing them in, as our peer supports specialists, they're showing the folks that we touch and that we meet where they're at that, it can be done. It absolutely can be done. That if you want it, that it can be done, and you can reverse yourself and be that functioning, that part of society again. So that's our prevention side. Our interventions, the big one here is going to be our PORT, which is the post-opioid response team. That's where we're going to I think we're going to make the biggest splash to be able to do this. Right now, we're able to go into our hospital, and actually the sheriff's been tremendous with us, working with us, is allowing us to get into those that are justice involved and get into the jail and support folks there, helping them begin that reentry process from behind bars. Our EMS and law enforcement, Narcan administration, the distribution of more of the naloxone, the fentanyl test strips. Not many folks have known about that, but we were actually one of the first organizations in the state to do that, where we actually were giving out test strips, again, going along with the intervention and the harm reduction aspect of things. So, I mean, if folks are going to get a drug or use it, they're able to test it to see if it's actually what they say it is, or if it's this horrendous fentanyl that is out and about. The community transportation, that's where we're actually able to take folks and get them to those 39 individuals that I spoke to as far as getting them to the residential treatments. We've transported those. I've been able to, actually myself, I've been on many of those. As my previous role as a community paramedic, I was able to help and transport those folks. And then that overdose mapping, so we're kind of getting an idea of where those overdoses are happening throughout the county. Treatment, again, go back to our port team there. The new one that I like to highlight there is our peer support in the hospital and jail, and then the asterisk there is the telehealth side with the new improvement in the jail with the internet and such that's there, the new IT side. We're going to be able to do tele appointments through the jail, so we don't have to physically go there, which then can open the doors for even the behavioral side, the behavioral health side of things. The mapping, we go back to the treatment, and then the other asterisk here that we're looking for is that medication-assisted treatment, being able to assist folks with that. We've run into a couple of caveats there, but we're still making some strides to get that up and going. And then the mental health counseling. Hopefully, down the road, we'd like to have a mental health professional embedded with us, but again, we're kind of starting out with this multidisciplinary team right now. Recovery, we're going to monitor folks post-treatment to help them, through that workforce reentry program. We'd like to have some housing, without folks being able to, have a roof over their head. It's going to be very difficult for any of this to be achieved. So partnering with surrounding counties, looking outside of our county, unfortunately, because we don't have any that are here right now. Recovery coaching, the peer support gentleman that was just hired, he's actually a recovery coach. Gina, our other peer support specialist, will be attaining this certification as well. We're going to tap into our community, our faith community, to help come along and into our recovery network, and then again continue with our residential treatment referrals. So the stigma, I'm sure we're all aware of where this is. There's stereotypes that are out there, unfortunately, and I like to think about it that a lot of these we see as overdoses, but a lot of them are not overdoses. They're poisonings. They're poisonings. If I have chronic issues or chronic pain and I'm not able to get or to have that analgesic that I need, and I know of somebody that could potentially find that for me, it might be illicit, yes, but a lot of these times that's what it is. They're going to get this one pill, this analgesic, and it's not what it's supposed to be. It's fake. It's fentanyl that's been pressed to look like that pill. Okay? That's a poisoning. That's not an overdose. That's not an overdose. We're going to help reduce that stigma by changing the language, the use of person-first language. This doesn't define folks in having this disorder, just like folks that suffer from cancer or someone that is a diabetic. We want to be able to show that they are a person first. Next one's page. So kind of the last couple ones here, this is kind of going back to what the opioid settlement is. I'm not sure if everyone's familiar with it, and the memorandum of agreement, the MOA through the state. Again, Attorney General Josh Stein, we have the $26 billion that's coming to the state that's going to help bring these resources to our communities that have been harmed by this opioid epidemic. The 4 large companies that they were able to get this from through the litigation. So not only will we be able to use that, but again, there's been industry standards changes, which I'm sure everyone is aware of, that is going to help so that this will never happen again. Next one page. So here, so the MOA is kind of like the guideline of how we're going to be able to show and use this settlement money. The MOA is going to allocate 15% of that. That's going to go to the state, and the other 85%, which is fantastic, is going to go to all 100 counties, and there's 17 municipalities that actually were included with this. So 117 different cuts of this MOA, or this settlement, is going to be placed out there. And again, it depends on the population. These are some things to kind of consider and to think about when you look at the settlement money. I highly suggest anybody to go and take a look at the dashboard and to see like the different areas of North Carolina and who's going to get what kind of money based upon the early predictions. Some of the payments have already come out, but the unfortunate part is, rural areas are usually the areas that aren't getting as much. Okay, that's because the population's not there. And that's the unfortunate part a lot of times, because that's where you're going to need it the most. We don't have the infrastructure. We don't have the resources. We don't have the bus systems to be able to get folks around to get to these different areas. So it's just kind of an interesting thing to take a look at there. So there we are. We've got a couple QR codes that lead to our Restart our page, also to our emergency services page. And again, that's our contact number there. That goes right to our office, and that's myself, Jason Powell, there. Thank you for allowing me to be here.
All right. Anybody have any questions? Or it's working really well, so we appreciate it.
Yes, sir. Thank you.
Yes, sir. Next is our Civic Engage presentation. Libby Clark's going to make that.
It's very short. Most of you know that the commissioners have gone to a portal to get their agendas, their minutes.
Hello, everyone. This is a quick overview of the Civic. Hello.
That wasn't me, but it could be.
Just talking fast.
Yeah. You have to listen in a hurry. Starting with our board will be starting in May doing this because that's our next meeting. It's up and running. I've played with it a little bit. I did this agenda just to see if I could do it, and it worked. I had Abby, the clerk for the commissioners, look at it, and she said it looked good to her too. So we'll be using this portal in May at our next meeting. And you'll get a link. You'll have to sign up for it, and that's where you'll get your agenda and all the notes and everything. It's really neat because you can put, you can submit items to be put on the agenda, and we can send it straight to the commissioners. Once y'all approve, we can send it straight to them through that portal instead of me emailing you the packets every month. You'll still get the information, it's just the way you get it will be different. And the video will show you, kind of give you the highlights of how to do it. You can go ahead and run the video now if you want to.
Hello, everyone. This is a quick overview of the Civic Clerk Board portal. Every user will be provided with their own unique username and temporary password. I have already logged in, so I am on the agendas or the home page. Before we dive into the portal, we will go to the user menu in the top right-hand corner of the page. When you're logged in, your name will appear where my screen says System Admin. Under the user menu, there is an option for account settings. By clicking here, you will have the option to change your password at any time. Once we fill out the 3 fields, we can save our new password to secure our account. The next option on the user menu is email preferences. When this option is selected, we will be emailed when new agendas are published to the portal. We can get back to the agendas page by clicking on the agendas tab at the bottom of the page. Once you log into the site, this is the page you will see first. The agendas will show up as these cards and will be listed in chronological order with the most recent agenda first as they become available. To access an agenda, we are just going to click on the appropriate card. If we are at a meeting in progress, we'll have the option to join the meeting by clicking on the Join Meeting button. Next, we can select if we are present and voting or if we are a present non-voting member. the top of the page, we have the option to download a PDF version of the agenda or the full agenda packet. If we click on the agenda, we can see it will quickly download. On all PDFs opened in the board portal, we will have the option to annotate the document. If we click on Annotate, we can see various options appear. Here we can add arrows to point at information. We can also highlight or add text boxes. When we save these notes, they will be here next time we open this PDF document. My annotations are only saved to my account, so only I can see them. I'm going to exit out of this agenda so we can see other features available to us. Back on our agenda page, we can see all of the sections and items on the agenda for this meeting. We can find out more information about an item on the agenda by clicking on the name of the item. Once on the item page, we can see some basic information about the item at the top of the page, such as who created it, the department, and the recommended action. We also see an attachment list. If we were to click on any one of these attachments, they will open in the PDF annotator just like when we open the agenda. We can see if there are any speakers listed on the right. At the bottom of the page, we have a notes field. Here we can add any private notes. This field is helpful to add any comments or questions that you have regarding an item. If we add a quick note, we will see this page auto-saves as we add content, so no need to find and click Save. At any point, we can go back to the agenda by clicking on the Agenda Details button at the top. Another function available on this page is the flyout menu. By clicking on the three dots next to any section or item, we can see there are a few options for this item. Here we can see if there are any speakers listed. We can also see if there are any attachments on this item, or we can click on Review. By clicking on this option, we'll be brought back to the Item Details page. At the bottom of this page, you will see we can quickly navigate to the previous or next item. You also have the ability to star or favorite an item. This is useful to help remember particular items. If we go back to our Agenda Details page, we will see that item has been starred. If you do enter notes, you will have quick access to all of these notes by clicking on the Notes tab at the bottom of the page. We will then click on the agenda card to see all of the notes for that particular meeting. You can then click on the note to quickly jump to that Item Details page. That is all we have to cover in this video. If you have any questions, please reach out to one of your administrators for further assistance.
So y'all will, unless you bring your computers, you won't be doing it in real time here. But you can do whatever you need to do at home to download it or whatever. We'll still have all your packets here for you each time we meet. Any questions? I don't know any more answers.
What about smartphone? Like
Yeah,
Android or iPhone or
Yes.
one of the other both?
It's compatible.
Are you the administrator if they have questions?
Me and you both are.
Awesome.
Shared responsibility.
Yeah, and Abby has helped me tremendously this past week trying to get all this up and running. So if we have any questions, she's got us.
Yeah.
Thank you.
All right, thank you. Anna's moving around to highlight a couple things, an annual report and some about our accreditation, I think, and how smoothly that went last week.
Yeah. Thought I'd move down here. So I'm going to briefly go over our 2022 annual report that's in your packet. Christy Main did a great job on this, but she unfortunately couldn't be here tonight. So with vital records, this number kind of shocks me, but 777 births in Caldwell County residents, and then 6 at-home births, and then 1,193 deaths. Dental, just an overview, over 1,200 patients were seen, and that's roughly 3,731 procedures completed. In our clinical and community services department, they saw 11,234 patient visits, so that broken down adult health, 756, family planning, 742, and maternity, 471. Immunizations, this is a large number. So this has to do with our COVID vaccinations and then our school health immunizations. We did have an immunization event last year and it was really fantastic. We had a great turnout. And then our CMARC referrals and clients, you can see that number, and that's within our child health department. Environmental health, they completed 675 on-site permits. And then lab and CD had a lot going on last year besides COVID. I'm not even going into the COVID numbers. They also, you can see the hepatitis C numbers listed, syphilis, and then 4 newly diagnosed HIV infections. Not to mention, last year was the year of MRSA. We had that issue go on, and then, of course, monkeypox. So it was a very interesting year last year. So that's just a brief of our report.
All right, anybody have any questions or? We're working really hard. I do know that, so, and I appreciate it.
What's the CMARC?
Do you want to go into that, Jill?
It's, used to be CC4C, they changed the name.
Oh, okay,
It's case management for at-risk children.
okay.
Same thing as CC4C.
All right, next is accreditation.
Yes, so biggest thing is we passed. So exciting. Last week was very stressful. I do want to thank the board members that came in for an interview. That was very nice of you guys to come in and do that. I do want to thank management team. They've worked really hard the last, 6 years of worth of evidence finding last minute or over the course of the years, just finding that evidence for us. Sometimes the site visitors, when they come through, they want more information, or they're like, just keep asking questions about the same evidence. And management team was on it the day they were here. They were all upstairs. We were looking at the dashboard. But I do want to recognize Brittany. So if Brittany will come up here. She's going to hate me for this. Brittany is our accreditation team. We're supposed to have an accreditation team, and she is the team. Brittany had basically, I don't know how many hours of work that she put into accreditation. The day of the site visit, all she did was enter, because with the dashboard that I've been talking about, that Brittany's mentioned to staff, she was sitting in her office, staring at her computer, entering in as a site visitor coordinator kept coming through. Are you done yet? Are you done yet? And we're like, oh my goodness. She's worked very hard. So I wanted to recognize Brittany tonight and just thank her for her hard work. Not only everybody at the health department has done a fantastic job, but I think we have all seen the stress, everything that's gone on with this particular, task. She worked, Christmas, we had a holiday, came in, make sure everything was uploaded on the dashboard, and not every county is lucky to have that, so. And I don't know if you want to tell them kind of what the score was.
So our score was, we had 147 activities. We got 143 of those activities correct, so we're at a 97%.
Yeah.
And
Great
also
job.
that, we were on a 4-year cycle because of COVID. We had 2 extra years, so that's also 2 extra years of evidence that had to be submitted that normally doesn't take place.
Right. Well, it was a great job. I'm going, let's give her a round. Everyone, yeah.
And for management team too, those extra 2 years, that was hard, trying to deal with COVID and trying to get all of our stuff in. But just meeting the needs of the site visitors and having green lights come in whenever the dashboard opened back was just a relief for us as well. We're not officially accredited yet or reaccredited. We go in May the 25th to receive our plaque and our seals. So we can't really do anything else, but we wanted to let you guys know and recognize Brittany tonight. So it's exciting.
Yeah,
Very good.
Thank you.
thank you.
Libby is going to, if you've not already, I think I sent you guys an invitation to a luncheon we're having next week. But Libby will resend it as well.
All right. Well, myself and Dr. McBurney had the pleasure of going and meeting last week, along with Wayne Rash, as in our interview process, and when I got there, I just knew there was a lot of stress in the building. So, but you folks handled it well, and we certainly appreciate that. And this is big to be accredited.
Absolutely.
And we don't take that lightly, and a lot of work goes into it, and I don't know how many I have been through now of these, but several, and none of them are easy. And unfortunately, we start right now gathering evidence for the next cycle. And will it be in 2 years now?
Before.
So we will go 4 years? Okay, so a lot more evidence to keep up with, but anyway, we appreciate everything you do, all the staff. Next is the establishment of an ad hoc budget committee, and it's that time of year in the county when budgets are going to be starting to materialize and be worked on. So how many people do we usually do?
I need
Two?
three.
Three?
Three.
So
Well, we have 4 here.
excluding myself, that
Excluding
means
yourself, we're pretty
Angela. We can put people on this that are absent from the meeting tonight.
Nominate Wayne.
Wayne Rash has been nominated. So I don't know. I mean, I'll help with that if I need to, and certainly can be available. So
What I can do is I can send an email out and just see like more interest
Well,
of the people
as
that's
of
not
right
here.
now, my class didn't make, so I'm not teaching. I will be available.
Okay.
so
I'll just move some people around. We'll figure it out.
Okay, I got my 3.
we'll
I'll like
Okay.
we'll get it worked out then. I appreciate you folks volunteering to help with that.
Thank you.
So, anything else for the good of the group or the meeting tonight? I'll entertain a motion that we adjourn.
So move.
A second?
Second.
All in favor say aye. Aye. Thank you again for being here. We are adjourned.